Okay, so now I'm going to be showing you all how to do a hearing screening. We're just gonna kind of run through all of the different steps that we talked about. Again, we're not audiologists, so this is just a screening. And then we'll make the recommendations for whether they're doing okay and can just be rescreened in a year or a few years, or if we recommend that they see an audiologist and seek further evaluation. So, hi, May. Welcome. My name is Alicia. I am the speech language pathologist that will be doing your hearing screening today. So, first, I'm going to start by just asking you a few questions about your hearing history, and then we're going to be doing the hearing screening with these headphones and my audiometer. Have you ever done this before? You may have in the past.
I think I had a long time ago.
Yeah. So it goes on your ears. You're going to raise your hand when you hear the beep. So if that sounds familiar, that's what we're going to be doing today.
Perfect.
So let me just start by asking you if you have any concerns regarding your hearing.
At this time, at this time,
Have you ever had a hearing test previously?
when I was, I think, right before graduating high school, which is a long time ago.
And were there any concerns at that time?
No concerns at the time.
Great. Do you have a history of ear infections or ear pain, discharge out of your ears?
No, no,
Great. Have you ever had any ear surgery or ear tubes?
no.
Wonderful. Have you ever experienced any ringing in your ears?
Not ringing, but recently I went to. I think I used I used a Q-tip, and I think I kind of damaged something in there. It made a noise. It kind of like when you have liquid in there, your ear.
Mm-hmm.
Um, it kind of lasted about a month. It went away.
Okay. Was this in your right ear or your left ear?
It was in my left ear.
Any dizziness, any regular dizziness that you feel? Do you have any family history of hearing loss?
No,
Do you have any history of exposure to loud noises? So,
I do.
construction, concerts. Yeah.
I do. When I was in college, I used to go out, you know, clubs would have like very loud music. And at some point in my life, maybe I had like very loud music in my car as well.
Okay. And have you ever had any head injuries or head trauma?
No.
Okay. So, what I'm going to do, I'm going to put these headphones on your ears. I'm going to go around the back. You're going to look straight ahead so that you can't see what I'm doing.
Perfect.
You're going to hear me. You're going to hear it's all going to be at the same volume. We'll do it once louder so you know what you're listening for. They're pretty soft, the tones. You're going to hear them at the same volume, but at three different pitches. So you'll hear the beep three times um, at a lower pitch, middle, and then a highest. Then we'll switch ears, and it'll be three times each. Same thing. Okay.
And what do you want me to raise my hand?
You're going to raise your hand after you hear the tone. You're going to raise your hand.
To the side of the beat.
It can be decided. It doesn't have to be. So
Okay.
a lot of people do it automatically, but you don't have
Oh,
to.
you just have to raise it when the beeps.
Just raise a hand when it beeps. Okay. Any questions?
No questions.
Great. So I'm going to put the headphones on. Okay. We want to make sure our red is on the right ear and blue is on the left ear. His right, his left. So let me make sure I'm doing this correctly. Okay. Right, left. Make sure that looks good. How does it feel? It should
Feels good.
good. Okay. It should feel tight, but it shouldn't hurt.
No.
Okay, it's great. Okay. So now what I'm going to do, I'm going to start at, I'm probably going to start at 30 dB just to do a conditioning round at 1000 hertz. So when I'm going to press the tone, if Heidi hears it, he'll hold it. He'll raise his hand. Great. So now he knows what he's listening for. I'm going to go down to 25 dBs. You can do 20 if you're in like a soundproof booth. You might do it at 20 dBs, but usually we're not. So 25 is usually good for an adult. You can go up to 30 or 35 if you're in a noisier space, and make a note of that on your phone. So I'm going to move up to 25 dBs starting at 1000 hertz in the right ear. Okay. Okay, so you heard it at 3 tones. I can check that when it goes up to 2,000 now. Okay, and if you'll notice, I also try, it's really easy to get into a rhythm and a pattern when you're pressing the buttons, but then your client's going to anticipate it. So try and stagger them a little bit as you can. So we're all good at 2,000. Now I'm going to move to 4,000 hertz. All right, now we're all done with the right ear. Now I'm going to switch to the left ear. I'm going to press my F2, go to left. Okay, go back down to 1,000 hertz. Same thing, other side. Okay, now I'm going to go up to 2,000. Okay, down. I'm going up to 4,000 hertz in the left ear. Okay, so I heard everything, all 3 tones at all 3 frequencies in both ears. If at any point, even if he heard 2 of the tones at 4,000 hertz and not one, that would become a refer. So just keep that in mind, even if he hears most of them. Again, there's lots of reasons that can happen, and we'll explain that to the client. But we do want to, refer if there's any tone that's missing. Okay, but I may heard all of them, so I'm going to circle pass on my sheet, and now I'm going to come back around and explain the results to him. Okay, so thank you so much. So when we did this, you heard all of the sounds the first time I pressed them, so you are all good. We passed the screening. We do recommend that every few years you do get your hearing rescreened to make sure that there's no hearing loss, especially as we get older. We want to make sure that our hearing stays intact. But if you ever have any concerns, definitely speak to your physician. They might be able to point you in an additional direction.
Perfect.
Thank you so much. Have a great day.
Thank you.